Hey everyone, my name is Amog, and I'm a fourth year and one of the course directors for IGL. Today we're going to be going through an introduction to clinical imaging. Now I'm going to go through a few different imaging modalities, and for each one I want you to be able to answer just four basic questions by the end of the lecture. So the first is, how does it work? The second is, when do I use it? Which is arguably the most important question we have. The third is, how much radiation am I going to be exposing my patient to? And fourth is, how much does it cost? Now, I'm not going to go into a whole lot of detail about each one of these imaging modalities, but I would like you to just have a basic idea about kind of the general understanding for each of these modalities so that when we talk about them in the future, you'll have a better idea about what they actually mean and what we're actually thinking about when we're ordering these tests. Okay, so the first test that we're going to start out with is X-ray. So an X-ray is basically a snapshot of a specific part of the body. Now, we're not going to get full body X-rays. Really, what we're going to be doing is getting an X-ray of a specific part of the body. So whether it's the chest or the abdomen or a specific joint like the knee or the thigh, like in this picture. Really what we're doing is we're taking a highly charged bunch of electrons and we're shooting them through a specific area of the body, and we're seeing the way that they scatter and taking a snapshot of that scatter. So highly dense objects where the electrons will scatter everywhere against it are going to look white, whereas low density objects or air where there's no scatter whatsoever are going to appear black. So everything in between is going to be some type of shade of gray. So in this picture you can see that the number labeled 1 is basically just air. It's the air surrounding the leg. Right here we have it's a patient it's a kid actually. It's their left thigh looking from the left. So we're looking at the thigh bone right here, the femur, and then these are the soft tissues that are surrounding the bones, muscle. So it's a little bit uh, less dense than the bone right here, but it is still a little bit white compared to this area right here, which is actually a different density, which gives us a giveaway clue right away that it's not soft tissue, but it's probably something else. And in this case, it's actually fat. It's actually a lipoma, which is just basically a mass of fat that's less dense than surrounding soft tissue, um, but it's still obviously more dense than the air that's surrounding the leg. So this is basically just a snapshot of this patient's thigh, and a kind of easy way to look at an X-ray and kind of see all the different types of tissues that you can see. Now, radiation-wise, obviously X-ray, there is some radiation. It is very, very small. Um, we use X-rays quite a lot, so the exposure over time is probably a little bit higher than we'd like, but on a test-by-test basis, it's pretty low, so we don't really worry about it. In terms of cost, X-rays are a very, very cheap test. So the combination of low-level radiation plus low cost um, gives us a pretty quick, easy test to do as a quick snapshot, an easy way to look at something and say, okay, what do we need to do to take what else do we need to do to maybe get a better look at this image? It's kind of our initial snapshot, our initial picture of what we like to take a look at and then eventually make decisions on moving forward. Okay, so moving on. A CT scan is a little bit different. It's the same technology as an X-ray, which is that high energy electron shooting it through the body. But in the case of a CT scan, we're taking cross-sectional images and then we are basically taking them from a 360-degree view around the patient. And this helps us basically create a slice-by-slice, layer-by-layer map of the patient. And it helps us look at bone, soft tissue, and vessels all at the same time. We don't have to do separate tests to look at each of these structures. We can actually look at all of them at the same time. It just depends on the angle at which we look at the image. Again, high density structures are going to be white, so your bones are going to be looking white. Low densities are going to be black, so the air in your lungs are going to be black, and everything else is going to be some shade of gray. Now, when we look at a CT scan, the way we look at it is kind of visualized by this arrow. So if we have this guy, he's lying down on a bed right here. It's as if we're sitting at his feet and looking up at him, okay? And basically what we'll see at any given time is a slice of his body that's basically a cross-section of his body at that point in time. So I've got an animation here that seems to stop and start on its own, which is kind of strange. But basically what we're doing is we're taking slices of this guy's body from all the way up from his neck, all the way down his chest, and into his pelvic region, and then eventually his legs. So you can see that once we restart, I'll have a better idea. This is his heart. These are his lungs. Now this is his liver, his kidneys on the either side, his guts, and then this bone is his pelvis, and then they go straight into his legs. So you can see that we're basically we're looking up in this direction, and we're going slice, 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 slice. So you can see how this is a pretty powerful technique, right? We're getting a huge area of the body that we're imaging, and we're getting a lot of detail. We can actually see organ by organ. We can even get individual blood vessels. We can actually see the differences between the two and their surrounding areas. So it's a very, very powerful imaging technique. However, it's not without its faults. Because it's a series of cross-sectional x-rays, it's a significantly more radiation-intensive procedure. So compared to an x-ray, it's probably 3 or 4 times as intense of radiation exposure. And to go along with that, because it's a little bit more involved, it does cost a little bit more. So we're a little bit more careful when we order CTs, mainly because of the radiation dose and the additional cost, than we are with an x-ray. Typically, whether it's good or bad, it's kind of what happens. A patient comes into the hospital, they're going to automatically get a chest x-ray, but they may not always get a CT of their chest or their abdomen or something like that. So we're a little bit more careful with CTs just because they're a little bit more intense, a little bit more radiation intensive, and they're a little bit more costly. Now, there are a few different things we can do with the CT. We can do a plain CT like we looked at in the previous slide. We can also do a CT with contrast. Now, contrast is basically going to help us highlight a specific area of interest, and those areas that have the contrast are basically going to be high density, highlighted areas of CT. So contrast helps us basically find exactly what we're looking for, and then we can look at the surrounding tissues to see the relationship with exactly what we're looking for. So there's 2 different ways we can give contrast. We can give oral and we can give IV contrast. When we give oral contrast, basically the contrast, that high density material is going to stay inside the GI tract. So the esophagus, the stomach, the intestines, small and large, and it's eventually going to get excreted. So taking CT images with oral contrast is going to help us differentiate structures in the GI tract. It's going to help us look at how things move through the GI tract if we're suspecting like a perforation or some abnormality that's going to change the way that fluid is going to move from each part of the GI tract onto the next. In a similar fashion, if we give IV contrast, that contrast is going to stay in the bloodstream. It's not going to go into the GI tract. So it helps us visualize the way blood vessels are related to its surrounding structures. Now, a classic example of this would be if we suspect that a patient has a tumor and we're wondering a little bit more about the tumor. What kind of blood supply does it have? How kind of vascular is it on its own? Because typically, if a tumor has its own blood supply or is creating its own blood vessels to supply itself, that's typically a more severe stage of tumor and warrants a little bit more serious investigation and therapy. So CT with IV contrast can help us take a look at the blood vessels in that area. The blood vessels are going to light up, so we're actually going to see the tumor, and we're going to see the vessels inside it light up right away. It's going to help us get a much better idea about that tumor and what else we can do about it to treat that patient. Now, next imaging modality is ultrasound. Now, there's a lot of cool physics behind ultrasound, but I'm not going to go into a whole lot. Basically, the idea is we take high-frequency sound waves and we bounce them off of our tissues, and the way that they echo back to our ultrasound probe is the way that we create a relative assessment of density of that tissue. And so basically we use these sound waves to create a cross-sectional image of a specific part of the body. And typically it's most effective in visualizing body cavities or anywhere there's fluid, where we can tell the difference between the density of the fluid and the density of a soft tissue. So, like I've written over here, it's a quick, easy, portable method of looking at body cavities, tissues, and blood vessels. Now, this is an example of what an ultrasound looks like. This is actually an abdominal ultrasound, a right upper quadrant ultrasound um, of a trauma patient. And so we're looking at here, this is just for your reference so you can see what we're looking at. Right over here is the liver, and over here is just a little bit of the patient's lung. Right here is the kidney. Now, typically, there is no kind of black space in between the liver and the kidney. Um, and remember, black space basically means low density material. And so what we're seeing here is that um, there's actually kind of a little bit of kind of dead space, which we can actually assume to be fluid in between the liver and the kidney, which is a very, very bad sign. It basically means that this patient is in pretty bad shape. They have either a rupture, organ rupture, or they have a vessel that's bleeding into this cavity and is causing uh, us to see this space on ultrasound. So again, ultrasound is a great way of looking at cross-sectional images to help us look for fluid or help us look for varying densities of objects. Now, because we're using sound waves, there is absolutely no radiation exposure, which adds to the usability of an ultrasound. It's a very cheap test um, comparatively to CT or maybe MRI or things like that. Pretty similar to probably the cost of an X-ray, but there is no radiation costs. So ultrasound is much more frequently used all over the hospital and whatever specialty you're in for diagnostic and procedural uses. So it's a very, very useful imaging modality and one that you should definitely be familiar with. Now, like we did modify the CT and talk about contrast, there is one specific thing you can do with ultrasound that adds a little bit more flexibility and gives a little bit more information, and that's an ultrasound with Doppler. Now, you'll remember that the Doppler effect from way back in physics is basically that when you have an object that's traveling towards you, like the classic example is like a train, when you hear the train whistle coming towards you, it sounds louder, it's a higher frequency, and when it's going past you and it's going away from you, it sounds softer, it has a lower frequency. So basically, we can do an ultrasound, and if we do an ultrasound with Doppler, we can apply the same idea where a higher frequency sound is going to be traveling towards the probe, and if the sound is traveling away from the probe, that means it's lower frequency. So we can use this to create kind of an assessment of where blood is flowing, the directionality of flow, and how fast blood is flowing, specifically through blood vessels. So ultrasound with Doppler is a great way to visualize blood vessels and get a feel for how well blood is flowing through that vessel. So in this image, we actually have the carotid artery prior to its bifurcation. And in this specific image, the yellow basically means that the blood is moving very, very fast. And the darker the color, the slower the blood is moving. So you can see in the kind of single carotid artery, prior to it bifurcating, it's moving very, very quickly. And after it splits, it actually is slowing down. So this could mean that the patient has some type of disease after the bifurcation. Maybe it's a irregularity in the blood vessel wall or something like that that's causing the blood vessel to slow down. But typically, it gives us this is how ultrasound with Doppler helps us. It gives us a better idea of how fast blood is flowing, where blood is flowing, if we're concerned about any type of vascular problem. Okay, so our final imaging modality we're going to talk about today is MRI. And again, it's a fairly common imaging modality, but it's a little bit different from the other imaging modalities that we talked about. Instead of using radiation or sound waves, MRI uses magnets. And the basic idea behind an MRI is that we have two perpendicular magnetic fields that are acting in opposite directions to each other. And they're basically used to manipulate hydrogen atoms in our soft tissues, which are spinning basically constantly, right? Hydrogen atoms are always spinning. And we use these magnetic fields to manipulate those atoms and create cross-sectional imaging that's most effective in visualizing soft tissue. Now, typically we'll use an MRI to look at the brain, to look at the spinal cord, to look at the nervous system as a whole. But we'll also sometimes use it for looking at soft tissues such as the liver, the pancreas, or the spleen. Typically, when we're using MRIs to visualize these tissues, we're looking for masses, tumors, kind of soft tissue mass irregularities, which is great. What MRI really helps us look for diagnostically. Now, because we're using magnets, there's obviously no radiation exposure, which is great. In this sense, MRIs become more and more commonly used in the pediatric population. Rather than exposing a child to a CT, where they're going to be getting a pretty significant dose of radiation, um, you can get fairly good um, soft tissue imaging with an MRI for children, and that's become a kind of increasingly popular test. But unfortunately, there is cost associated with it. It's a very, very expensive test, unfortunately, still. Um, Although the cost has come down from when it was first kind of unveiled as a new diagnostic modality, but it's definitely the most expensive of the four basic imaging modalities. So it is something to keep in mind um, when you're thinking about your decision making. Your first line are going to be your ultrasound and X-ray, and then move on to a CT, and then eventually an MRI if it's warranted. So um, cost-wise, it is definitely the most expensive of the four. So that's it for today. Pretty high level, kind of basic lecture. Really just wanted to give you guys a basic idea about what each of these four imaging modalities are used for. The radiation, which really would just be focusing on X-ray and CT. Ultrasound and MR are both ultrasound and MR are both radiation free. And then kind of thinking about the costs of each of the tests, ultrasound and X-ray being the cheapest, CT being the next, and then MRI being the most. Um, Hopefully you guys find this useful as we go on for the rest of the sessions. We'll be talking about a lot of these and their different uses with the different cases that we go through. So um, I hope you guys found this useful. Feel free to contact me if you have any questions whatsoever. My email is listed right here. And look forward to working with you guys the rest of the year. Thanks.